News at 11. Well, one of the most common childhood illnesses, hand, foot, and mouth disease, usually begins to show up this time of the year. 6 News anchor Lori Tucker is on your side tonight with caring for our kids.
Thanks, Kristen. The rash-causing virus is highly contagious. It can look really scary, but the good thing here, it is preventable. So joining us now from Children's Hospital is Dr. Kristen Farr. Thank you for being with us.
Absolutely.
All right, so let's talk about this. Are you seeing cases of hand, foot, and mouth disease?
We are, particularly in our emergency room, but it's very common this time of year. It usually starts in summer, goes through fall. So we're definitely seeing it.
Okay, the signs and symptoms can be scary, but let's walk parents through what to look for.
Okay, so one of the symptoms will be fever. That's always a concern of parents. Another will be poor appetite, and we'll kind of talk about why that is. Sore throat, which kind of contributes to that poor appetite. And then the scariest part, which parents are kind of concerned about, are the painful sores that can develop. You can see them on the hands, on the feet. It can actually be on your entire body, diaper area. And also in your mouth, which again contributes to that not wanting to eat.
So what can you do for these things at home and you need to see a doctor obviously as well, but how can you give your child some relief from that?
Well, the first thing is obviously going to be preventing it. So washing your hands is going to be critical. And
that's the key in everything, isn't it?
Absolutely, because it's a virus. There's really no treatment as far as an antibiotic treatment. You just have to let it run its course. Typically lasts about 3 to 5 days, like most viruses do. Sometimes you can, you obviously, if the child is symptomatic from their fever, treat them with Tylenol. If they're old enough, above 6 months, you can treat them with ibuprofen or Motrin. And then sometimes you can coat their mouth with maybe a little bit of Benadryl if they're old enough to, and that kind of helps the sore throat as well.
It gives them a little bit. So there's really nothing we can do other than
just
preventing it, like you said. What could be a complication of this? Why do we need to get care for our kids?
Well, the most common complication and what a lot of parents are concerned about is the not drinking part, and so that's what we most commonly see, which would be just dehydration. So if you're able to just make sure that the children are able to drink, then that's the critical part there. Very rarely can you have a severe complication. In fact, that's we rarely ever see that, and that can you can sometimes get like an aseptic or viral meningitis, but that's very, very rarely. Usually this is a very benign disease, a disease that most children just get over with on their own.
Just very concerning though, and again, very contagious. So hand washing, the key. Thank you so much, Doctor, for being with us.
Absolutely.
We appreciate it. And if you have a question about your child's health, just send me an email, ltucker@wate.com. And of course, be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air. Kristen?